What's a skilled nursing facility, you ask? An SNF, pronounced SNF, is a skilled nursing facility. During COVID-19, the whole world learned what a SNF was. But do you really know what skilled nursing facilities are and what they do? Today, I'm going to give you insider knowledge because I was working in a SNF when COVID hit back in 2020. I'm Erica Tice. I earned my master's in business administration in healthcare management, and I have been a public servant for over 30 years, helping people navigate the U.S. healthcare and insurance systems while following federal and state regulations. In this video, I am not here to talk about COVID. I want to help you and your loved ones understand the history and the purpose of skilled nursing facilities and the benefits they offer. I'll be covering several important topics. If you want to skip ahead to a specific topic, check the time chapters in the description below. Today, I will discuss the following topics: the difference between skilled care and long-term care, long-term care residents in the facility, the care you can expect to receive, age expectations, different departments and their functions, credentials of the staff, the resources available, basic information about how you pay for your stay, and what the ultimate goal of being in the facility is under your circumstances. Question: what is the history and purpose of a skilled nursing facility? People often ask when a nursing home or a rest home became a skilled nursing facility. The shift happened because federal law 60 years ago, in 1965, when Medicare and Medicaid were created, the government introduced a new category called a skilled nursing facility, or a SNF, for facilities that could provide medical and rehabilitation services covered by Medicare. Over the next 2 decades, nursing homes split into 2 regulated types. The first one was a skilled nursing facility, or a SNF, where short-term rehab and skilled care, and secondly, nursing facilities, or NFs, were for long-term custodial care paid by Medicaid. In 1987, the Nursing Home Reform Act formally standardized these definitions, and from the 1990s on, healthcare system widely adopted the term SNF. So today, SNF usually refers to the medical rehab-focused side of care, even though many people still use nursing home in everyday language. Question: what is the difference between skilled care and long-term care? In a SNF, staff monitors the resident and documents the care and treatments provided on a daily basis. This includes anyone who makes contact with the resident. It could be nursing staff, caregivers, dietary or activities departments, social services, the business office, etc. All interactions are documented. The Center for Medicare and Medicaid Services, also known as CMS, has clear rules and regulations on how they differentiate between skilled care and long-term care. The reason they want these differentiated are due to the cost and who is responsible for paying for their stay at the SNF. As long as a resident is in need of licensed medical care, they qualify for skilled care services under Medicare's CMS guidelines. This also includes the need for nurses, therapists, IV medications, and wound care, etc. Once it has been determined the skilled patient has reached their baseline, they are cleared to be discharged home or to a safe living environment. On the flip side, according to CMS, long-term care is when a person has plateaued with their licensed nursing care or therapy services. At that point, the resident plateaus and cannot safely discharge back home, then they become a long-term care or a custodial care resident, and the method of payment changes to either Medicaid, private pay, or insurance policies that continue to pay, which is rare. Unfortunately, for some people, they just never recover back to their original baseline, and they end up living at the SNF for the rest of their lives, or until other arrangements can be made to move them to safe living environments where someone who can provide all the ADLs for them. ADLs stand for Activities of Daily Living. For long-term care residents, this does not require a licensed nurse, but does require a certified nursing assistant or a CNA. Another term is an NAC, a nursing assistant certified. ADLs that the CNA or the caregiver may perform could be anything from bathing, dressing, toileting, transferring, feeding, and mobility, such as pushing a resident in a wheelchair. Question. You're probably wondering why I'm referring to residents in the skilled nursing facility as residents and not patients. This can be a bit confusing, and trust me, it took some time to get used to myself. When a patient is in the hospital receiving treatment for acute care, they are referred to as patients. Acute care means there was a sudden onset of something happening. Someone had a stroke, they broke a hip, they were in an accident, they had a heart attack, etc. All of these conditions are emergent and the patient needs immediate care, i.e., acute care. Once the patient is either discharged home or transferred to another facility, CMS states that they are now living at these facilities and is now considered their home. Therefore, CMS has delegated the name resident when they are living in a skilled nursing facility. Only when they are receiving treatment on a short-term basis, such as a hospital, they are referred to as patients. Question. Can I expect to see long-term care patients living in the facility? The short answer to this question is yes. You will likely see long-term care residents at the facility. However, you will likely not know for sure. It's unlikely, as there are HIPAA guidelines that protect the residents' rights unless it is shared with you by the resident that they are there for the long term. Let's put it this way. In 2020, the CDC documents 15,300 licensed skilled nursing facilities in the United States with 1.6 million licensed beds. At that time, there were 1.3 million people residing in skilled nursing facilities. Granted, COVID significantly inflated those numbers as beds were needed everywhere. As of 2024, the Kaiser Family Foundation, also known as KFF, documented that there were 1.2 million people living in SNFs. Now, how many are long-term care residents? Well, based on a widely cited breakdown, around 57% of residents are long-term care. This means approximately 700,000 residents living in a skilled nursing facilities are long-term care residents. Therefore, you have a high probability of running into a long-term care resident while you are healing. Question. What kind of care can I expect to receive in a SNF? Once you have been accepted by the skilled nursing facility and all the final documents and insurance verification have been completed and a bed is available, you will be transferred directly from the hospital to the skilled nursing facility, usually by a cabulance, which is a wheelchair accessible van, or a BLS, which is a basic life support ambulance, depending on your needs. BLS ambulance are typically used if you are on a ventilator or have a serious ailment that would not allow you to sit in a wheelchair to be transferred. However, this is arranged through the hospital and the SNF, so it's not really a concern for you to worry about. It's more of a logistics between the two facilities. When you arrive at the skilled nursing facility, several staff members will check in to make sure you're comfortable and safe. One of the first people you'll meet is a nurse who will complete a cognitive assessment and a full skin assessment. During the skin check, the nurse will examine your entire body, including your private areas, to look for any signs of skin breakdown, bruises, open wounds, or pressure sores. If wounds are present, the nurse will measure and document them so they can track whether they're healing over time. This assessment becomes the baseline for your stay. The nurse will also ask a series of questions to understand your medical history, current symptoms, and pain levels. This helps them determine whether you need medication right away or if you are due for any scheduled medications upon arrival. In addition, the nurse will identify the supplies needed for your care, such as briefs, wound dressing, topical medications, catheters, or other items, so the facility can ensure everything is stocked and ready for you. Next, you'll meet with a member of the therapy department. They will complete an assessment to determine your baseline, evaluate your current abilities, and identify which therapies you may need. These may include physical therapy or PT, occupational therapy, OT, speech language pathology, which is SLP, and respiratory therapy, RT. Your therapist will also evaluate whether your wheelchair, walker, or mobility devices are the correct size and fit for you. If they're not, they will adjust them or ensure you receive the appropriate equipment. If you use a prosthetic limb, therapy will coordinate with the prosthetic companies to make sure it fits properly or arrange for a new one if it's needed. The great thing about therapy, which may not seem so great when you aren't feeling well and being pushed to keep trying, is the more proactive you are about working with therapy, the sooner you will start seeing results and feeling better. I like to say, I see miracles happen every day when I would watch people working with the therapists. Try not to get too upset or discouraged with them when they are working with you. They are licensed and trained professionals that know exactly what you need to get better. I know sometimes it can be tough. Most skilled nursing facilities have a medical director, who is the physician responsible for overseeing clinical care. Although they are on staff, they are not typically in the facility full-time. Their job is to review and sign off on medical orders that the nursing team submits. Because the nursing staff and care team handle the day-to-day care, you may only see the medical director once or twice during your stay, if at all, during your entire stay. Some SNFs also employ a full-time nurse practitioner, or an NP. If so, the NP will usually be more involved in your daily care and can sign off on orders as needed. While the medical director is not as hands-on as the nursing and therapy teams, they are available to answer medical questions, either directly or by relaying the information through the nursing staff. In SNFs, your medication is managed and administered by nurses. Your medication distributions will be documented in your chart and will be given to you at allotted times. Additional medication can be given to you according to the doctor's orders. For example, if you are having breakthrough pain or a headache, the nurse will be able to provide that for you. Caregivers are known as NACs or CNAs. This means they are certified nursing assistants, and they will help you throughout your day on a regular basis. Here's a short list of some of the tasks that caregivers will provide to you regularly. These tasks are not all inclusive, but they do include meal delivery, delivery of drinks, snacks, coffee throughout the day and night. Typically, you will request these. They provide showers, assist with dressing, bathing, brushing your teeth, brushing your hair, changing your briefs, changing out your bedding, bagging up dirty clothes or soiled clothes for the laundry, assist with positioning or transferring, assist with mobility devices, such as pushing your wheelchair. All of these are everyday tasks caregivers perform. Of course, you may not need all of them. However, I wanted you to be aware of your options. You will also meet the dietary manager. They will find out if you have any food allergies or sensitivities, like likes or dislikes, etc. You will be given a menu to choose your meals over the next several days. You will meet with a social worker who has been assigned to you. This is the person who is able to give you outside resources and who will ensure you are returning to a safe living arrangement. They will also work with a team, including the insurance company, to ensure that you are continuing to need licensed care. They will talk to you about what your living situation is and if there is someone who can help assist you once you return home to your original living situation, if that's still possible. You will also meet with the activities director. This director will ask you specific questions and find out what your personal interests are and let you know of all the activities that will be available to you and the other residents each day. This can include playing games, reading, having crossword puzzles delivered to you, movie night, arts and crafts, etc. They will also find out if you need assistive listening or reading devices such as specialized headphones or magnifiers such as large print on documents. Finally, the business office manager may come to see you if there are questions regarding your insurance coverage. They may discuss Medicaid coverage with you if they feel it may be a good option. They may verify demographic information such as the spelling of your name, your address, telephone number, emergency contacts, or to find out if you have a power of attorney. The business office manager is in charge of insurance billing, and the insurance claims need the exact spelling of your name, date of birth, social security number, and insurance ID information. Therefore, you may be asked to provide copies of your insurance cards, driver's license or government-issued ID, Medicare card, etc. Be prepared as these documents are likely to be requested. The business office manager should also discuss your insurance coverage with you. If Medicare is covering your stay, they should explain to you that Medicare only covers a certain numbers of days while you are in the skilled nursing facility, as long as you remain skilled. They will also find out if you are going to be responsible for any copays. They may ask if you can afford your copay, or if you can afford to pay privately if necessary. The business office manager and or the social services department will want to know if you have any documents regarding a durable power of attorney or a DPOA, a POA for your health and financial decisions. And if you do, if you want the staff to talk with them about these pertinent details. If you do have a power of attorney, please plan on providing these documents and your power of attorney's contact information. When it gets to the insurance side of the discussion, it can be overwhelming. Therefore, I will cover some of the basics as part of a separate question. What are the different forms of therapy offered in a skilled nursing facility setting? To break down the difference between PT, OT, SLP, and RT, you may have a different therapist depending on which therapy modality you need. It is likely you were receiving therapy while you were in the hospital, so this shouldn't be too different for you. For these therapy examples, I will use someone who may have had a stroke and has paralysis on one side of their body. PT, or physical therapy. They help residents regain strength, balance, and mobility after an illness, injury, or stroke. For example, a physical therapist may work on walking, balance, or coordination exercises for the weaker side of the body. They may use tools like stationary bikes, resistance bands, or light weights to strengthen the arms, legs, and hands. They may also teach techniques to improve your gait, posture, and movement patterns. The goal is to help residents move safely again independently and return to their daily activities. They will work with you on different exercise techniques depending on the muscle groups that need attention. For example, if you had a stroke and one side of your body is weak, they may have have you practice walking down the hallway or ride a stationary bike to help strengthen your leg muscles and to get your foot moving properly again. In addition, it's likely one of your hands isn't as strong as it once was. Therefore, they will be working with you on hand exercises, gripping techniques, and light weights. OT, or occupational therapy. An occupational therapist helps residents regain the skills that they need for daily living so that they can return home safely and independently. They work on sit-to-stand exercises to strengthen muscles for getting out of bed, chairs, or off the couch. They help with reaching, bending, lifting, such as taking items from the refrigerator shelf. They re-establish daily living skills like cooking, dressing, or folding clothes. Even simple tasks can feel challenging after a stroke, and OTs provide support, guidance, and encouragement to ensure exercises are done safely and progress is made. The focus is always on practical skills that improve independence and quality of life. SLP, or speech language pathology. They help residents who have difficulty speaking, swallowing, or communicating. A stroke could cause your tongue to experience weakness or numbness. You may have difficulty in understanding or expressing language. This is where speech therapy comes into play. They work directly with you to strengthen the oral muscles and coordination, assist with swallowing activities and swallowing difficulties, and improve speech clarity. The goal for the speech language pathologist is to help you regain as much function as possible to be able to communicate safely and effectively in everyday life. RT, respiratory therapy. A respiratory therapist is a bit more specialized, and you may not receive the other therapies if you are on a ventilator. One of the main jobs of a respiratory therapist is to remove excessive mucus from the tracheostomy or ventilator tube. The mucus builds up, can make a gurgling sound, which needs to be carefully suctioned. Respiratory therapists may also administer inhaled medications. They teach breathing exercises for people with chronic lung conditions such as COPD, pneumonia recovery, or asthma. They monitor lung functions, manage oxygen therapy, and ventilators. Question: can my primary care doctor come to see me while I'm a resident in the SNF? Absolutely. Your primary care physician is welcome to visit you, make recommendations, but it is the responsibility of the skilled nursing facility's medical director or other contracted physician to officially sign off on any orders, as this could be a liability issue for the facility. Unless your primary care doctor, also known as your PCP, is contracted with the SNF, you will likely not see them at the facility while you are a resident. PCPs typically have their own outside practice and only see patients while they are present in their clinic. Now, if you are in a rural area, it is possible your doctor may be contracted with the SNF and complete what they call rounds and see you while they are rounding the facility. Rounding means the physician is reading each assigned patient's clinic, hospital, operative, and therapy notes, making recommendations, and visiting with patients at their bedside. This is a common term not only in a skilled nursing facility, but in a hospital setting. The physicians who likely round at a SNF are more focused on geriatric, meaning older patients, as this is typically the type of patient they are used to working with on a regular basis. Question: am I allowed visitors during my stay? Absolutely. We want you to have family and friends around. Just like in a hospital, skilled nursing facilities allow visitors, but each facility sets its own visiting hours and guidelines. Since COVID-19, many facilities have adjusted their policies to protect residents. Some may require screening, masks, or may temporarily restrict visits during outbreaks. It's always best to check the specific facility, learn their current visitor rules, and safety precautions that are in place. Question: how old can I be to become a resident at a SNF? Anyone who is 0 to 17 years old who are ill or need round-the-clock care in a nursing facility type situation would go to a children's hospital rehabilitation clinic of some sort. Therefore, the rest of the population who are 18 years old and older who need around-the-clock nursing care would likely be admitted to a SNF. According to the Centers for Disease Control, also known as the CDC, 83.5% of residents in a nursing home are 65 years old and older. Only approximately 16 to 17% are younger than 65. Just to be clear, going to a SNF is not your only option. However, the purpose of this video is to educate you on skilled nursing facilities in general. Question: can I tour a skilled nursing facility before I commit to staying there? Absolutely. You should always tour a skilled nursing facility before making a decision. Seeing the facility in person helps you understand the environment, staff, and quality of care. Here's what to do and what to look for. Questions to ask. Number 1, what is the staff to resident ratio? Number 2, how do you handle medical emergencies or changes in a resident's condition? Number 3, are there therapy services available? Physical, occupational, speech? Number 4, what is your visitation policy and are visitors allowed during meal times or activities? Number 5, how do you handle resident grievances or complaints? Number 6, what is the average length of stay and turnover of staff? Number 7, how do you manage infection control and cleanliness? What to look for? You should look for clean, well-lit hallways and rooms, residents who look comfortable, engaged, and well cared for, friendly, attentive staff interacting positively with residents, organized medication and therapy areas, activities posted or happening in common areas. Red flags: residents left in bed or alone for long periods. Staff seem rushed, overworked, or unfriendly. Unpleasant odors, clutter, or dirty areas. Frequent staff turnover or short staff shifts. Unexplained injuries or residents appearing neglected, and inefficient timing on call lights. Here's a tip. Take notes and, if possible, visit more than once at different times of the day to get the full picture. Question: do all skilled nursing facilities have their state survey book available for visitors? No. Not all skilled nursing facilities display their state survey results in a physical book, but they are required by federal law to make certain information available to residents and families. Here's what you need to know. What must be available: most facilities are required to post a summary of their most recent state survey inspection and any deficiencies. Secondly, many states or CMS require that this information be posted in a visible area like the main lobby or the nursing station. You can also request a full survey report from the administrator, which will show detailed findings, citations, and any corrective actions taken. Alternative ways to access survey information: you can look up any facility by name to see inspection results, staffing levels, and quality ratings on the CMS Nursing Home Compare website. Also, your state health department websites often have survey reports available online. Here's a tip. Always ask the admissions team or the administrator if you can review the most recent survey. If they hesitate or refuse, that could be a red flag. Question: will I be assigned my own room in a skilled nursing facility? Skilled nursing facilities typically do not have individual rooms. Most rooms in a SNF are doubles. The room is likely divided by a curtain separating the two individuals. One person typically gets a window, and the other one usually gets closer to the restroom. However, each building is designed differently. Therefore, the layouts of the rooms will be different. Male residents are roomed with other males, and females are roomed with other females. In the off chance there is an individual room with one bed, it typically will be left for someone who is private pay or someone who has a higher acuity of care. Each room has a restroom, a sink, a small closet, and a couple of drawers and a nightstand. Only plan on bringing your essentials, as you will likely be sharing these common spaces with someone else. Question: in a skilled nursing facility, what if I get assigned a room with someone I don't get along with? Prior to arriving at the SNF, the admissions and nursing staff will go over the beds available to try to accommodate the best possible fit based on medical records forwarded by the hospital. Now, this does not always tell us the personalities or any issues that may arise. However, conflicts do arise between roommates, and if there are things that cannot be worked out between the two roommates, social services and nursing will work together to make arrangements for a room change. There are a lot of details that go into a room change, so it will take some time to figure out the logistics. Bring this up to the nursing staff or social services as soon as you have concerns, and they will work with you to come up with a solution. Question: what if I am a fall risk? What precautions will the skilled nursing facility take for me? Unfortunately, as we start getting old, falls do happen. Prevention is always key. In skilled nursing facilities and the like, caregivers are trained in many fall prevention methods. I will name a few. At the bedside, fall mats will likely be placed on the floor next to you. The bed may be lowered into its lowest position. Therefore, if you roll out of bed, it's a softer landing and less space to fall. Staff will wrap a gait belt around your waist, which allows them to help keep you vertical and prevent you from falling, as they will have a good grasp on it when they are working with you. Lastly, patients who are fall risk, the caregiving staff may put an alarm on you or your bed, which will notify the staff immediately. Question: am I allowed to go out of the skilled nursing facility building to attend other doctor's appointments while I'm a resident? Yes, you may absolutely leave the facility to attend other doctor's appointments. It is not uncommon for other appointments to be scheduled while you are a resident in a skilled nursing facility. Question: who schedules my outside doctor's appointments while I'm a resident in a skilled nursing facility? When other outside doctor's appointments are needed, you, your DPOA, or your guardian will likely schedule these appointments. There are times when the nursing staff or social services will schedule an outside appointment for you. However, it depends on the necessity and or the urgency of the appointment. Regarding long-term care residents who are on Medicaid, according to your local and state laws, the social services department will likely schedule dental, hearing, vision, and podiatry appointments. There are times when the SNF will contract with these practitioners, and they will likely come into the facility to meet with the scheduled long-term care residents. Whenever you leave the facility, the nursing staff will give you a packet of documents to share with your provider. The documents typically include your current medication lists, therapies, your latest blood sugar numbers, and any recent notes for that particular provider. When you are leaving the provider's office, they will likely give you some documents such as an after-visit summary and an appointment reminder card. Make sure you place all of these documents inside of the envelope that the facility provided. When you return to the skilled nursing facility, it is your responsibility to let the nursing staff know that you have another appointment scheduled. You will hand those documents back to the nursing staff so that they can read through and document any recommendations from your provider and take note of your next appointment. Question: who provides transportation from the skilled nursing facility to my appointments? It is highly recommended that you have a family member, DPOA, or a close friend take you to your appointment. However, we do know that it isn't always possible. Because you are a resident in a skilled nursing facility, the SNF must provide this transportation for you. It is common for the facility to have a few contracts with transportation companies, such as Cabulances, Ubers, or the local bus system such as paratransit that accommodate wheelchairs comfortably. Some facilities even have a handicap accessible van and a driver whom can help drive you to your appointments. Question: what if I need someone to go to an appointment with me and I am a resident in a skilled nursing facility? It will likely be recommended that you have a family member, a DPOA, or a close friend to accommodate you to your doctor's appointment. However, the SNF does have a responsibility to provide a personal care assistant or a PCA to individuals that require assistance at their outside appointments. Not every resident needs a PCA. Some residents are independent to where they don't need a PCA to accommodate them to their appointments. This is an example why the SNF needs to know about your appointments ahead of time, as not only does transportation need to be requested a few days in advance, but the nursing staff needs to ensure there's going to be enough staff on hand to accommodate you to your appointment. This is a team effort and a lot of people are involved to ensure your appointments move efficiently and effectively. Question: what are the different departments and their functions within a SNF? Admissions, or the sales department. The admissions department receives the initial referrals from the hospitals. However, they do far more than just accept referrals. They communicate with hospitals, verify insurance, check bed availability, conduct pre-admission screenings, coordinate with nursing and therapy, speak with families, give tours, prepare admission paperwork, and get all of the documents signed. They arrange transportation, track the facility's census, and they build relationships with hospitals and other referral sources. They're essentially the sales and intake team for the entire SNF. They even make sure your room is clean and ready for you. Nursing department. The nursing department is led by the Director of Nursing, often called the DNS. This team is responsible for coordinating all the resident care and ensuring the facility is properly staffed based on the current census. The DNS oversees nurses and nursing assistants, manages daily care, operations, and ensures residents receive safe, consistent, and high-quality care. Therapy department. The therapy department includes physical, occupational, and speech therapists who help residents regain strength, mobility, independence, and communication skills. They provide individualized treatment plans based on each resident's goals, whether that's walking again, improving balance, completing daily tasks, or strengthening, swallowing, and cognitive abilities. Their work has a direct impact on the resident's recovery, confidence, and overall ability to return home or function at their highest level. Dietary department. The dietary department is responsible for planning, preparing, and serving nutritious meals that meet each resident's medical needs, dietary restrictions, and personal preferences. They coordinate closely with nursing and therapy to support specialized diets such as diabetic, renal, heart healthy, or texture modified meals. Their work directly affects residents' health, safety, comfort, and overall satisfaction, as good food is a major part of the residents' daily quality of life. Social Services Department. Social services supports residents emotionally and socially. They assist with care planning, discharge planning, counseling, advance directives, and family communication. Their work ensures residents feel heard, supported, and prepared for transitions, improving overall well-being and quality of life. The Activities Department. Activities provides daily engagement through recreational programs, social events, cognitive activities, and outings. They help residents stay active, connected, and mentally stimulated. Their work directly impacts the residents' happiness, purpose, and social interaction. A business office. The business office handles billing, insurance, Medicare, Medicaid coverage, and financial questions. They guide residents and families through complex paperwork and payment processes. Their clarity and accuracy reduce stress for the residents and help ensure continued access to care. Human Resources, or HR. Human Resources manages the employment paperwork and compliance process for facility staff. HR handles payroll, accounts payable, onboarding records, background checks, and credential verification, including required licenses, certifications, and education. Some facilities also require pre-employment drug testing. Their role helps to ensure staff are properly vetted, authorized, and compliant with state and federal requirements. Housekeeping and laundry. Housekeeping and laundry keep residents' rooms, common areas, linen, and personal clothing clean, sanitary, and comfortable. Their work protects residents from infections, promotes dignity, and helps keep the facility looking and feeling like home. Maintenance Department. Maintenance ensures the building, equipment, lighting, HVAC, call lights, beds, TV, cable, telephones, and safety systems all function properly. Their work keeps the residents safe, prevents hazards, and ensures the facility is comfortable and accessible. The Executive Director, who is also known as the Administrator. The Executive Director oversees the entire facility, operations staff, compliance, budgeting, quality, and resident satisfaction. Their leadership sets the tone for the care standards. A strong administrator means a more safe, organized, and more resident-focused environment. Question: what are the staffing ratios per resident? Staffing ratios in a SNF can vary depending on the state regulations, facility size, resident needs, and level of care. There is no single universal ratio, but here are the general guidelines. For RNs, about 1 nurse for every 20 to 30 residents per shift. LPNs and LVNs, about 1 nurse for every 10 to 15 residents per shift. CNAs, about 1 aide for every 6 to 12 residents per shift. Therapists may see 6 to 10 residents each per day, depending on their needs and therapy intensity. Dietary staff and activities, so the staff adjusts based on how many residents are in the facility and what care they need. Higher care units like rehab or memory care usually have more staff per resident to ensure safety and personalized attention. Question: why would someone not get accepted into a SNF? There are many reasons, however, I will share 4 examples with you. Number 1, if the patient was in a SNF within the last 60 days, they may have used almost all of their Medicare days on a prior stay and may not have enough Medicare days left, as they would remain in the same benefit period as their prior stay. Secondly, Medicare and commercial insurers reimburse SNFs a per diem rate, not itemized billing. That means the daily rate must cover room, board, therapy, care, and medications. Some medications cost hundreds or even thousands of dollars per day. If a patient requires a medication that is significantly more expensive than the facility's per diem reimbursement, the staff may financially lose money. Many facilities decline such referrals unless the payer will approve separate reimbursement, which is rare, but it does happen. Third, if the person is a registered sex offender, they have little to no chance of being accepted. Facilities can legally decline admissions for safety and risk reasons. Sex offenders often face barriers because some states have restrictions on where they can reside. SNFs must protect vulnerable adults under federal and state laws. Families and other residents may object. SNFs commonly deny these referrals due to safety, liability, and regulatory concerns. Fourth, if the referral shows the patient has what they call behaviors, this is a red flag for the facility. In SNFs, behaviors typically refer to aggression, exit seeking, severe agitation, verbally disruptive behavior, danger to self or others. Facilities must ensure resident safety, staffing capability, that they are not admitting beyond their clinical capacity. If a patient requires a behavioral specialist, higher staffing ratios, or secure units the SNF does not have, they will often decline the admission. Question: what benefits are available to me as I am recovering in a skilled nursing facility? When you're recovering in a SNF, you have access to a wide range of services designed to support your healing, safety, and comfort. These resources include: number one, nursing care 24/7. You'll have round-the-clock access to licensed nurses and nursing assistants who handle medications, treatments, wound care, vital signs, pain management, and daily assistance like bathing, dressing, and mobility. Number two, rehabilitation therapy. Many SNFs offer physical, occupational, and speech therapy to help you regain strength, independence, and mobility so you can return home safely. Number three, medical oversight. A medical director oversees care. You may also receive visits from nurse practitioners or physician assistants who manage your medical needs and coordinate with hospital or specialty providers. Number four, social services support. Social workers help with emotional support, discharge planning, family communication, advance directives, and connecting you with community resources. Number five, dietary services. Dietary staff prepare meals based on your medical needs, food restrictions, and preferences. You may receive help with special diets, swallowing concerns, or nutrition plans. Number six, activities program. Daily activities such as crafts, games, music, exercise groups, and social events help keep you mentally and socially engaged during your stay. Number seven, housekeeping and laundry. Your room is cleaned regularly and your clothing and linens are washed for you, helping keep your environment safe and comfortable. Number eight, maintenance services. The maintenance team ensures that your equipment, your call lights, your bed, and room environment are safe and functional and comfortable. Number nine, the business office staff are available to answer questions about insurance, Medicare, Medicaid benefits, billing, and financial responsibilities related to your stay. Number 10, hairstylist and beauty services. Many skilled nursing facilities offer on-site beauty and barber services. A licensed hairstylist may visit weekly or bi-weekly to provide haircuts, shampoos, styling, and sometimes nail care. These services help residents feel clean, confident, and cared for, boosting dignity, emotional well-being, and overall satisfaction during their stay. Number 11, chaplain or spiritual support. If offered, some facilities offer chaplain services or host spiritual groups to support emotional and spiritual well-being. Question: what should I bring with me while I am staying at the SNF? It's important to know space is limited for storing your belongings. Typically, there is a small closet, possibly with a couple of shelves or drawers. There should also be a nightstand with a couple of drawers. When preparing for a stay at a SNF, Packing thoughtfully helps make your experience comfortable, safe, and stress-free. What you should bring: clothing. Comfortable, loose-fitting clothes such as sweats, pajamas, socks, slippers with non-slip soles, and a few outfits for outings or therapy. Personal care items: a toothbrush, toothpaste, hairbrush, shampoo, soap, deodorant, and any other daily hygiene items. Medications and supplements. Bring all current prescriptions in their original containers. The nursing staff will verify them. Please note, check if the facility accepts outside medications, as they may want to order them through their pharmacy. Not all facilities accept outside medications. Important documents: insurance cards, an ID, advance directives, and any other medical records. Comfort items: bring your favorite blanket, a pillow, photos, or a small personal items to make your room feel like home. Assistive devices such as glasses, hearing aids, dentures, a cane, walker, or a wheelchair. Question: what should I not bring with me to the SNF? Do not bring the following items: valuables, large sums of cash, expensive jewelry, or irreplaceable items. Facilities are not responsible for lost or stolen items. Hazardous items: candles, portable heaters, heating pads, scissors, or anything that could pose a fire or safety risk should not be brought to the facility. Large or unsafe electronics. Some facilities have restrictions on cords or devices that could cause falls or accidents. Food and drinks. Many facilities have dietary restrictions. Bringing your own could interfere with care or therapy. However, this may not be recommended, but the facility cannot prevent you from bringing outside food or drinks. You have rights as a resident to always check with the facility ahead of time. They may have specific rules or recommendations about what you can bring. Question: do I have rights as a skilled nursing facility resident? Yes, you absolutely have rights. Skilled nursing facilities are required to provide you with a list of residents' rights. Under federal law, OBRA of 87, and CMS regulations, all Medicare and Medicaid certified skilled nursing facilities in every state must follow the same rules. Number 1, the right to dignity and respect. This means the right to be treated with respect, courtesy, and dignity. The right to live in an environment free from abuse, neglect, and harassment. Number 2, the right to privacy. The right to privacy during personal care, visits, phone calls, and medical treatment. The right to confidentiality of medical and personal records. Number 3, the right to make your own choices. You have the right to participate in care planning, to choose your daily routine, clothing, activities, and meals within reason, and the right to refuse treatment after being informed of the risks. Number 4, the right to be fully informed. You have the right to be fully informed about your medical conditions, medications, and treatments, about facility rules, charges, and services, and about changes in care or room assignment. Number 5, the right to voice grievances. You have the right to complain without fear of retaliation, and the right to contact the ombudsman, survey, agency, or the advocacy organizations. Number 6, the right to visits. You have the right to receive visitors of your choosing and the right to communicate privately with family, friends, clergy, and associates. This is subject to reasonable safety rules. Number 7, the right to be free from restraints. You have the right to be free of physical or chemical restraints. They cannot be used for discipline or convenience. Physical or chemical restraints are only allowed if medically necessary and ordered by a physician. Number 8, the right to maintain your own finances or to receive help managing funds with written consent. Number 9, the right to safe and appropriate care. You have the right to care that meets professional standards, adequate supervision and assistance, and access to necessary medical services. Question: how do I pay for my skilled nursing facility stay? Paying for skilled nursing care can be one of the most confusing and stressful parts of a stay. Don't worry, I'm going to break it down in the simplest way possible. There's a lot to cover, so take your time with this section and review it as needed to fully understand your options. The CDC estimates 85.5% of residents in a nursing home are 65 years old and older. What does this mean for people who are receiving Medicare benefits? Medicare Part A may cover up to 100 days in a skilled nursing facility per benefit period. But coverage is not guaranteed for all 100 days. To qualify, you must have a 3-midnight inpatient hospital stay and continue to require skilled care. Medicare pays 100% of approved costs for days 1 through 20. Beginning on the 21st day, a daily coinsurance applies. $209.50 a day in 2025 and $217 a day in 2026. Coverage can end earlier if you no longer meet Medicare's skilled criteria. One of the most important requirements for Medicare SNF coverage is the 3-midnight inpatient hospital stay. This must be 3 consecutive midnights as an admitted inpatient, not observation status. Each new day starts at 12 a.m. midnight. Once this requirement is met and you are admitted to a Medicare certified skilled nursing facility, Medicare Part A will cover the first 20 days at no cost to you, assuming skilled care criteria continues to be met. Medicare coverage can continue up to 100 days, but only while you remain what facilities commonly refer to as skilled. This means you must require daily skilled nursing or skilled therapy services and continue to show measurable progress. If you plateau, stabilize, or no longer require skilled services, Medicare coverage can end before day 100. If you reach day 101, Medicare pays nothing, and you become responsible for the full daily private pay rate, which varies by facility and level of care. To put this into perspective, if you remained in a skilled nursing facility from day 21 through day 100 in 2025 and did not have secondary insurance, your out-of-pocket cost would be $16,730. Here's the math. 80 coinsurance days, which is $209.50 per day, which equals $16,730. In 2026, that same 80-day stay would total $17,360 at a $217 a day copay. Let's look at another example. Suppose you have Medicare Part A and a secondary insurance plan, such as a Medigap supplemental plan like Blue Cross Blue Shield. Coverage can vary by plan, but many Medigap policies will pay the Medicare Part A coinsurance for skilled nursing care, which can help cover the daily copay starting on day 21. Not all plans cover every day up to 100, so it's important for you to check your specific benefits. Here's the key point. Medicare Part A always covers 100% of days 1 through 20. Beginning on day 21, Medicare pays for all approved services, except for the daily coinsurance of $209.50 per day in 2025. If your secondary insurance covers that coinsurance, you may have little to no out-of-pocket costs for your stay. Keep in mind, each insurance policy is different. The facility's admissions team or the business office can help verify exactly how much your secondary insurance will pay for non-covered days before you are admitted. It's always best to confirm this ahead of time so you understand your potential costs. Furthermore, you are not alone if you only have Medicare Part A coverage. Not everyone has a Medigap or Medicare Advantage plan, and the thought of a $17,000 copay can be very stressful. That's completely understandable, and there's no need to panic. Many people in your situation have successfully navigated this process, and transparency with the facility's business office is key. The business office manager, or we call the BOM, B-O-M, is responsible for ensuring the facility gets paid. This means they may need to ask you some very personal questions about your finances to determine how your stay will be covered. During the intake process, you may be asked about your bank statements, retirement funds, and any other assets. Any assets given away worth over $5,000 in the past 5 years, property ownership, vehicles, and any other valuables. You also need to provide documents such as the past 3 months of bank statements, government-issued ID, and insurance cards, Social Security card, and annual statement, VA benefits, if applicable, mortgage or rent receipts, utility bills, retirement accounts or pension statements. If it appears that you cannot cover Medicare Part A coinsurance, the office manager may recommend applying for Medicaid long-term care coverage. This application can sometimes be started at bedside, but it requires supporting documents and careful review. Don't be surprised if the facility needs you to submit a new application, even if you previously started one at the hospital. They don't always transfer over. The Medicaid application process usually takes a few days to weeks, depending on your state's Department of Social and Health Services, or DSHS. If all documents are submitted promptly, the process can move quickly. If your Medicaid application is approved, you will receive what they call an award letter from your state's DSHS, specifying your copay amount. In many cases, Medicaid may also cover any unpaid Medicare Part A coinsurance, so that $17,000, they would help you pay that. If it's determined that you are what they call over-resources, this means you currently have enough assets to cover your Medicare Part A, coinsurance, and Medicaid will not contribute, younger residents, and other coverage options. If you are among the 16 to 17% of skilled nursing residents under the age of 65, you may not have Medicare Part A, and that's okay. Your health insurance will be verified. If your policy covers post-acute care, a skilled nursing facility, your insurance carrier can explain how many days they will pay for, any copays or out-of-pocket costs. The team at the skilled nursing facility is responsible for verifying this information before your stay. Finally, if you already have Medicaid prior to admission, it may cover your skilled nursing stay, depending on state rules, facility participation, level of care, approval. Question: what if I own a house and go on Medicaid long-term care insurance? Will the state take my house from me? If you go on Medicaid for long-term care, the state does not automatically take your house. Your primary residence is often exempt while you're alive. However, under Medicaid estate recovery, the state may seek reimbursement after you pass away or if the home is sold. In some cases, a lien may be placed on the property, but it does not force a sale. The state can only recover up to the amount Medicaid paid for your long-term care, and there are important protections for spouses and certain family members. Question: do most people use all of their 100 days in a skilled nursing facility? No, it is extremely rare to justify someone continuing to need 100 days of continuous licensed professional care. Therefore, it is not unusual to be discharged prior to your 100 days. Research shows that the average stay for Medicare beneficiaries in a SNF is generally around 25 to 45 days, depending on the population and context. A CMS analysis conducted in 2004, along with subsequent analysis, consistently found the average Medicare covered skilled nursing stay was about 24.3 days. Question: how long should I plan on being in a skilled nursing facility? Research shows that the average stay for Medicare beneficiaries in a SNF is generally around 25 to 45 days. In my experience, this number is not out of the ordinary. The length of your stay ultimately depends on your ailments, participation in therapy, and overall need for licensed professional care. Question: are hospital stays counted the same as skilled nursing stays? Hospital stays and skilled nursing stays are not counted the same. A hospital stay is an acute care, while skilled nursing facility stay is post-acute care. Medicare treats these as separate benefits, and hospital days do not count against your 100 available skilled nursing days. Question: what is a NOMNC? If you are using Medicare coverage, your stay when the team has decided that you no longer qualify for licensed skilled care, such as you plateau or you have used up all of your available Medicare covered days, social services will have you sign a form that they call a NOMNC, which stands for a Notice for Medicare Non-Coverage. This notice informs you that in 3 days, Medicare will no longer be covering your skilled nursing costs, and all licensed services are coming to an end. Therefore, it's time to discharge home or become a long-term care resident. If you disagree and refuse to sign the NOMNC, you have the right to request an expedited appeal through the BFCC-Q10 under federal law. Question: what is the ultimate goal of being in the SNF? The ultimate goal of being in a skilled nursing facility is to help you recover, regain strength, and safely return to the highest level of independence possible, ideally back to your home or a setting of your choice. A SNF supports this goal by providing 24/7 nursing care, rehabilitation therapy, PT, OT, speech-language therapy, respiratory therapy, medical oversight, personal care and daily living support, nutrition and medication management, help preparing you for safe discharge. Whether your stay is short-term, rehabilitation after surgery or illness, or long-term care due to ongoing medical needs, the focus is always on maximizing your health, safety, comfort, and independence. Question: how do I file a grievance in a skilled nursing facility? Every SNF is required to have a formal grievance process. A grievance is not only for situations where you are unhappy with your care, it can also be used for concerns related to communication, billing, safety, discharge planning, resident rights, or facility policies. If you have a concern, you can start by speaking with the staff member or the nurse involved. Many issues can be resolved quickly at this level. If the issue isn't resolved, you can contact the nursing home administrator or the director of nursing to formally raise the concern. You may also submit a written grievance. Most facilities have a grievance form available and a locked grievance box to help maintain confidentiality. If a form is not available to you, you can write a letter describing your concern, including dates, names, and specific details. You may also request a response in writing. Once a grievance is submitted, the facility is required to investigate the concern and response in a timely manner, often within 5 to 7 days. If the concern is not resolved, or if you are uncomfortable addressing it directly with the facility, you may seek help from your long-term care ombudsman, who can provide confidential assistance and advocacy. As a last resort, concerns can also be reported to external oversight agencies, such as the state survey or licensing agency. Question: who monitors and enforces state and federal regulations in a skilled nursing facility? Skilled nursing facilities are held accountable by multiple oversight bodies at both the federal and state levels. Federal Oversight Centers for Medicare and Medicaid Services, CMS. CMS sets the federal regulations that SNFs must follow in order to participate in Medicare and Medicaid. CMS also oversees quality standards, residents' rights, staffing expectations, and reimbursement rules. State oversight. State survey agencies, usually the Department of Health or Health Services. These agencies conduct regular inspections, which they are called surveys, investigate complaints, and enforce compliance with both federal CMS rules and state-specific laws. If violations are found, facilities may receive deficiencies, fines, enforcement actions, or even loss of certification. Resident Advocacy and Complaint Oversight Long-Term Care Ombudsman Program. Ombudsmen advocate for residents, investigate complaints, and ensure residents' rights are protected. They are independent of the facility and work solely on the residents' best interest. Additional accountability. State Medicaid agencies for Medicaid-funded residents, licensing boards for individual professionals, civil courts if legal action is taken. The bottom line: skilled nursing facilities are not self-policed. They are monitored through federal CMS regulations, state inspections, complaint investigations, and resident advocacy programs to ensure safety, quality, and compliance. Question: what is the etiquette while staying in a skilled nursing facility? Staying in a SNF is a shared living experience, so following basic etiquette helps to ensure a safe, comfortable, and respectful experience for everyone. Key guidelines to include: number 1, respect staff and residents. Follow instructions from nurses, aides, and therapists. Be courteous to fellow residents. Avoid loud noises or disruptive behavior. Number 2, follow facility rules. Observe visiting hours, meal schedules, and therapy appointments. Follow safety rules such as hand hygiene and call light use. Number 3, be mindful of privacy. Knock before entering other residents' rooms. Respect personal space and belongings. Number 4, participate when able. Join activities and therapy sessions. It helps recovery. Communicate your needs respectively with the staff. Number 5, practice good hygiene. Shower, brush your teeth, wear clean clothing, clean up after yourself in shared spaces. Number 6, communicate openly. Ask questions to report concerns to staff promptly. Share important health updates honestly. Following proper etiquette helps create a safe, supportive, and a pleasant environment, which contributes to faster recovery and a better overall experience. If this video helped you better understand skilled nursing facilities, please like, subscribe, and share it with someone who may need it. I post videos breaking down complex healthcare topics in plain language. And if you have any questions, drop them in the comments. You never know, I may answer them in the future Ask ET Plus episodes.